So I chose to become a surgeon because I think it's one of the most incredible jobs in the world. Orthopedics in particular, you're able to take on a mechanical musculoskeletal problem for someone, and you're able to fix that in a definitive and meaningful way that can significantly change their quality of life. After finishing my residency, I chose to undergo a shoulder and elbow fellowship. That's an area I'm passionate about. That's an area I have personal experience with, having surgery in myself. And that's an area where I think it's very advanced in orthopedics, and you can really help people from the full breadth of dealing with small problems to tendon tears to people with advanced arthritis. I chose to undergo a fellowship in New York because that's where modern shoulder surgery was basically invented and perfected. And it was an incredible opportunity with an amazing mentor, and I think I was able to see the full breadth and the full gamut of someone who's had decades of experience. Following that, I did choose to go overseas to work with someone of a similar prestigious level to understand some of the subtle differences and nuances and particular procedures they do to best treat people here. So I think the breadth of the problems that occur with the shoulder are things that start being minor, being things like tendonitis or bursitis. And the nice thing about those is you can often get patients better without surgery. After that, many folks have tears of the rotator cuff, and that now can be addressed in a minimally invasive way with arthroscopy, where they're able to have very small incisions and go home the same day, and typically that has fairly excellent results. For people who have more advanced problems like arthritis or joints that are really bothering them, there are new advances in shoulder replacement that offer new options even in the last decade for people who have problems that before could not be addressed well. And then I have unique interests in patients who've had more complex problems or may need a new surgery after they've already had a surgery, or a tendon transferred because their tendon's unrepairable. And I think those are unique opportunities to take people with a very difficult situation and make them better. So I think my goal, and the number one goal of everybody at SIU, would be excellence in patient care. But what's really unique about an academic practice is you get this incredible opportunity to teach young doctors who are interested in becoming surgeons or trained to become surgeons, while simultaneously being able to juxtapose that with being able to participate in research that can change treatments or be on a cutting edge of developing new ways of handling complex problems.